When you take the pill in, it doesn't target just your ovaries. It is systemic, so that women who are on the pill can experience symptoms of pregnancy, slight weight gain, being nauseous, sometimes breaking out with acne. When they go off the pill and they want to get pregnant, they may have great difficulty having that kick back in. It definitely has been linked more than 500 studies by Dr. Kallenborn, and you can get that through One More Soul. He has linked over 500 different academic studies that have linked contraceptive use with cancer. Here we've got the Susan Komen group, which was initially willing to drop funding sent to Planned Parenthood, which supports abortion. Now they're back in, and I want to say, have you looked at the studies? You are supposed to be such an expression for women. Look at the consequences. It's serious. It is serious. There are misguided mothers putting their daughters on contraception because they're so concerned about the fact that they're not going to stay pure. Why not treat your daughter with respect? Teach her the truth about what it means to save yourself for marriage, and don't complicate her life with all those hormones going through her system, especially at a young age, really increasing all kinds of medical dangers.
And some contraceptives prevent pregnancy by killing the child in the womb.
I think we have to be careful about what words we use. And I think some of the chemicals that are called contraceptives are in fact not just contraceptives, but also can also often cause abortions. And then that would make them abortifacients, which means that they're agents they are chemicals that can cause abortions. So I think, for example, a condom is clearly a contraceptive, and it would be wrong for the government to compel us to pay for condoms or provide or make condom machines, put them on our campuses and so forth. But the difference is that in some of these pills, the mechanism is kind of twofold. I think that what is called sort of what's called the regular contraceptive pill is mostly progestin, which is an artificial form of progesterone. And so, its normal mechanism, most of the times, is going to prevent ovulation, and so prevent conception. So it is a contraceptive. Even those pills can, I think, sometimes, and no one knows the exact percentage, but those pills, I think, sometimes, probably rarely, cause abortions because they may sometimes change the lining of the uterus and so prevent the implantation of the embryo onto the womb. There are other kinds of pills, like the morning after pill, which is levonorgestrel, which is another chemical, and there's a dispute. Scientists dispute this, so it's not clear, but exactly. But it operates usually by preventing conception, by preventing the joining of the sperm and the ovum, in other words, by preventing ovulation. But it also has, I think, a secondary effect, which is to change the lining of the uterus. And many scientists say that the morning after pill, that's the regular, what's called the regular morning after pill, does in some cases, in some fairly significant percentage of cases, cause abortions by preventing implantation of the embryo on the uterus. There's a third kind, or there's at least there's another kind of morning after pill. The new morning after pill called the chemical is ulipristal, and it works for up to 5 days. It's supposed to work for up to 5 days after sexual intercourse. Now, there's no question about that if it's working for 5 days after sexual intercourse, it's not. It's often working then it would be frequently, a significant percentage of the time, working by preventing implantation rather than by preventing ovulation. And so that would be causing an abortion. It was causing the death of the embryo rather than preventing conception. Now the Ella, that's the ulipristal, that's called, and that's the brand name is called Ella. That's one of the pills that would be mandated to be covered at no cost to the buyer, to the consumer, by insurance policies, including the religious institutions. So there's a distinction. The basic distinction is that a contraceptive pill, if it really is contraceptive, it's preventing ovulation. It's preventing the release of the egg from the ovaries, and therefore preventing the joining of the sperm and the ovum, therefore preventing the coming to be of a human being. Whereas an abortifacient, some of these chemicals can in some cases work as abortifacients. An abortifacient works by way of preventing the already conceived embryo from implanting on the uterus. So what happens in conception is that the sperm joins the egg, the male sperm, the sperm from the male joins the egg or ovum from the female, and they unite, become a new entity, that's when a new human being comes to be. That human being, that occurs in the uterine tube, or sometimes called the fallopian tube. And then it takes the embryo a few days to travel down the fallopian tube and then to begin implanting on the uterus. That's about day 5 or day 6 that it begins to implant on the uterus. But if the uterus, the lining of the uterus has been changed so that thinned out so that it's not as rich in blood vessels as it normally would be, so that it's receptive for implantation from an embryo, then the embryo will die, will not be able to implant. And that's what some of these chemicals cause. So some of these chemicals, simply as a factual matter, it's not a question of, there's no question about that, some of these chemicals do cause the deaths of tiny human beings. Part of our Catholic belief that those, and it's also something that I think you could show by natural law reasoning, that these actions are morally wrong, and particularly the use of abortion is particularly gravely unjust, or the use of abortifacient pills is particularly gravely unjust. And so to force us to fund that by our insurance policies it's not forcing us to directly will that those actions be done. What it is doing is it's preventing us from teaching by our actions. It's preventing us from acting or by functioning as a Catholic university or as a Catholic hospital. And because it's because Catholic hospitals, Catholic universities teach not only by their words, by their lectures and by their teachers and so forth, but also by their actions. And one of the ways we teach by our actions is by limiting our insurance policies to cover only those things that we don't think are intrinsically immoral. So by intervening and saying, no, you must fund these things by your insurance policies, that's preventing us from fulfilling our mission, or partly it's preventing us from fulfilling in part our mission to teach by action as well as by word.